In our studios, my good friend Dr. Joe Congini at Akron Children's Hospital. Joe comes out Sunday evening, Monday morning, sports hernia with Odell Beckham Jr. Baker steps in, says, well, maybe our doctors misdiagnosed. Odell Beckham Jr. says maybe a little bit, not a whole lot of comments going on with this. If indeed, sports hernia with OBJ, talk about injury.
Yeah, if indeed we haven't seen him, he has been listed, if you've looked closely, almost every week for the last couple of months with groin injury, limited in practice, limited in practice, limited in practice. He has not practiced much. That goes back to OTAs and before. He has not practiced much with groin injury. So we're figuring that difficult to put your arms around sports hernia. I'm telling you, from on the field, sports hernia, and we get them in high schoolers, especially in college players and elsewise. We deal with people with sports hernias. Very hard diagnosis to make. Difficult to know when exactly to do surgery on it. Well, number one, it's a rule out. Remember, it's not an inguinal hernia, although that's the area where it is. That's why they named the darn thing hernia. We all wish it wasn't called that. There's not an obvious look like somebody with a bad ankle sprain or a knee sprain. They just can't run and play. They limp and look like Tua looked when he was limping around and things. People with a sports hernia, you can't really look and tell the difference. And so they may be playing at 60% or 70% or 50%. They're not explosive. Football these days is all about explosiveness. Nick Bosa had one last year. Does he look explosive this year?
Yes.
Oh, my gosh. Coming off the edge, that guy, he got it fixed. He took his time, and it was a payday deal, but he missed the rest of the season. Kareem Hunt got one earlier this year while he was out. Does he look explosive back? Certainly. Now, did OBJ look right? Has it looked like there's been a timing problem? So when you're running a timing offense, particularly in passing game, not running game, but passing game, where a person's supposed to be in one place, and you're not sure if they're there or not, he is not explosive. He's not consistent. There's no continuity there, and it's all about continuity and that kind of a thing. And it just has looked like they haven't been on the same page. Certainly, the Browns look like Landry and Mayfield at Baker after a year have looked like they're on the same page. OBJ has not. He has not practiced over a long period. You can talk, I think, till you're blue in the face, but being around other teams, you have to work on some of the timing and work together to see some of these things, and it's been pretty much all year long. So sports hernia is tough. I know being thrown under the bus, that was, Baker was wrong in doing that. I think his thought is, as the team leader, he really was standing up for his guy that, hey, he hasn't been right all year. I think that's the point he was trying to make. He made it in a bad way. He's learning even at the press conference. We'll give him some time to learn, I hope, Cleveland fan. We can't get rid of things every year. Sports is continuity from high school to college to pro. The teams that have continuity and cohesiveness, well, we can't wait. We play the Super Bowl every week in Cleveland. We got to get rid of coaches, general managers. I heard people talking about get rid of Dorsey, start over again. This team is 4-1 in the last 5 weeks. If they had started 4-1, wow. But the first 4 of the first 5 games for the team was New England, Seattle, San Francisco, and who am I forgetting? That's a great team. And the Ravens, who we beat. 4 of the best 5 teams in the league. So that's the way the schedule started. It began to unravel after that. We need continuity. And in this relationship, getting fixed with a sports hernia, people are back fairly quickly, within a matter of a couple of months. And then you start out next year from the beginning of the year of these people working on cohesiveness and continuity.
Are there different degrees of a sports hernia? I remember when Donovan McNabb had his with the Eagles. It really affected his play, and they had to, but he played through the darn thing.
Yeah, he did.
I mean, are there different degrees of this?
There's different degrees, and it kind of worsens as time goes on. Then you're behind the 8 ball, you're mid-season. I think that was also the point he made. Hey, how about preseason, OTAs, do the surgery then. He misses the first couple games, but he was the new guy, and I'll play through it, and everything else is kind of the point you were making, that he was making about that. But now mid-season, you'd have missed the end of the season if you had the sports hernia surgery, but it's very hard to tell. even on great studies. So MRIs and things help us so much in diagnosing labral tears and ACLs. They're not so great with sports hernias. With sports hernias, it's more of a rule out. Rule out an inguinal hernia, rule out other things going on in the hip, like a hip labral tear and other things like that. You see a bunch of subtle things, but you don't see something definite that you point to and say that's a sports hernia.
Is it a pain or a weakness?
It's more of kind of a weakness, and that weakness manifests itself in lack of explosiveness and push in the legs. And so it really manifests itself when people are playing in a game more and they're just not at their full explosiveness, strength, and that makes it very, very difficult. And you can't see it during the week. People play through a lot of different things, but this is, it's very tough on us. To make a decision, to make a diagnosis. There's kickers very frequently who have gone through the year and had just a little lower kick percentage, or the ball hasn't gone as far. It's just not as obvious. And I'm here to tell you that it is a tough decision to make. And a lot of times, because it can be 6 or 8 weeks and people can be back playing, it's probably, when you're at this high of a level, sometimes a better thing to say, hey, let's early on get it taken care of so that athlete can be back at full strength.
Great stuff, Joe. Thanks for coming in.
Okay, Ray.
Dr. Joe Congenies at Akron Children's Hospital joining us in studio this morning.